gets thrown around a lot, but when we try to pin down what it really means, especially in nursing, it almost feels slippery. I was surprised to learn that even in the literature, there's no single universal definition.
That's the thing. Depending on where you are or what era you're in, professionalism can look really different. In nursing, it's not just about having skills, it's a mix of expertise, ethics, behaviors, and even a sense of duty to society. Honestly, it's a pretty dynamic process, not a fixed state.
Exactly, and I think that's what makes it tricky to measure. Some see professionalism as following rules, others as an attitude or even a way of life. And then you've got the expectations of society layered on top. So, in nursing, it's like wearing a bunch of different hats all at once.
And let's not forget it's also about connecting with patients and communities, not just technical know-how. I've met nurses who set the bar with their compassion just as much as their clinical skills. But now that we've opened up this can of worms, can we break down what actually characterizes professionalism for nurses?
It's a big topic, but from what I've seen, 3 pillars always come up. Applying specialized knowledge, committing to ongoing education, and weaving ethics into daily practice. Would you add anything else?
Absolutely, I'd add autonomy to that list. Nurses often have to make decisions on the fly, and that independent judgment is a huge part of the job. Plus, I think being part of professional organizations or contributing to research also signals professionalism, like you're invested in shaping the field, not just doing a job.
That's such a good point. And it's not just about the nurse's own skills, but also setting an example, being a role model for colleagues, advocating for patients, and maintaining a commitment to lifelong learning. The standards are really high.
For sure, and that high bar is exactly why there's so much emphasis now on supporting nurses to develop these traits. But it's not always easy sometimes. The work environment or lack of resources can get in the way. Speaking of which, maybe we should dig into what makes developing professionalism so tough for nurses.
It's kind of heartbreaking, isn't it? Even when nurses want to grow professionally, there are so many obstacles. From what I've read, things like heavy workloads, limited autonomy, and inconsistent education really make it tough.
Oh, definitely. And those structural issues like hospital hierarchies or outdated policies can really take the wind out of someone's sails. I've seen nurses feel stuck because they're not given the freedom to make decisions or develop new skills.
Not to mention, if there isn't a culture that values professional growth, it's easy to fall into just getting through the day. That sense of purpose and pride can fade, which is rough, because that's at the heart of great nursing.
Exactly. And it's not just about the nurse, it impacts patient care too. Studies have shown that when professionalism slips, patient outcomes can actually suffer. So, figuring out ways to support professionalism isn't just a nice to have, it's essential for healthcare quality.
That makes me wonder, with all these challenges, what actually works when it comes to building and showing professionalism in nursing? Let's talk about some real strategies. So, when it comes to showing professionalism, it's more than just following a code of conduct. Nurses can advocate for patients, communicate clearly, work well in teams, and keep up with current research and education. Do you have a favorite example of this in action?
Actually, yeah. I worked with a nurse who always took time to explain treatments to patients in plain language even during the busiest shifts. That level of respect and transparency went a long way, both for patients and for team morale. It really highlighted how professionalism shows up in little everyday moments, not just the big decisions.
I love that. Plus, things like continuing education, joining professional organizations, or even getting involved in research projects can all boost professionalism. It seems like it's a journey rather than a destination. You keep building those skills and behaviors over time.
And feedback is a big part of it too. Some hospitals use tools like the Professional Values Scale to help nurses reflect on their strengths and growth areas. It's not just about ticking boxes, it's about really thinking, how can I do this better? That mindset makes all the difference.
That's such a powerful way to frame it. Maybe next, we can chat about what's on the horizon, how the push for professionalism is shaping the future of nursing. Looking ahead, it feels like the expectations for professionalism in nursing are only going to get higher. Healthcare is changing so fast. New technologies, diverse patient needs, more complex care, and nurses are at the center of it all.
That's so true. And as the role of nurses keeps expanding, professionalism isn't just a nice extra, it's a necessity. It helps nurses adapt, lead, and make sure care stays patient-centered, even as everything else shifts around them.
It really does come full circle, doesn't it? By investing in professionalism through better education, supportive workplaces, and strong mentorship, we're not just helping nurses. We're making healthcare better for everyone.
Couldn't agree more. And for anyone listening who's in nursing or just starting out, know that developing your professionalism is ongoing. Every conversation, every decision is a chance to build that professional identity, and it truly matters.